views, information, or opinions expressed during AAOA broadcast series are solely those of the individuals involved and do not necessarily represent those of the American Academy of Otolaryngology Allergy, its employees, or members. The AAOA is not responsible and does not verify for accuracy any of the information contained in and assumes no liability for any activities in connection with these broadcasts. The primary purpose of this broadcast series is to educate and inform and does not constitute medical or other professional advice or services. Advertising which is incorporated into, placed in associate with, or targeted toward the content of this product without express approval and acknowledgement of the AAOA is forbidden. These broadcasts are available for private, non-commercial use only and may not be edited or modified from their original form or reproduced for distribution.
Hi, and welcome to Core Allergy and Rhinology Concepts, Age of Pandemics and Beyond. My name is Cecelia Damask. I am an otolaryngologist in private practice in the greater Orlando area. I will be speaking to you today about how the COVID-19 pandemic will forever change the practice of otolaryngology and allergy. These are my disclosures.
This is preeminently the time to speak the truth, the whole truth, frankly and boldly. Nor need we shrink from honestly facing conditions in our country today. This great nation will endure as it has endured, will revive and will prosper. So first of all, let me assert my firm belief that the only thing we have to fear is fear itself, nameless, unreasoning, unjustified terror, which paralyzes needed efforts to convert retreat into advance. In every dark hour of our national life, a leadership of frankness and of vigor has met with that understanding and support of the people themselves, which is essential to victory.
Our nation has definitely endured difficult times before, and we have come out ahead. I do believe that we as a nation are going to come out of this stronger as we have in the past. Hopefully, we can find some solace in history and learn from things that have occurred in the past. My job is to discuss predictions for practicing otolaryngology and allergy with you. I do believe that the words of FDR still really resonate with us today in this current situation. There is definitely a lot of fear and a lot of fear on the parts of otolaryngologists regarding opening back up of our offices. And this fear is part ourselves, but also it's that of our staff, our families, and our patients. And so the AAOA has put together a program to help guide you through this unprecedented journey in otolaryngology. This program is comprised of 7 parts that I'm going to highlight for you so that hopefully you can get the most out of this offering from the AAOA. In this section, we're going to discuss some of the basics of telemedicine, including how to get started if you aren't already doing telemedicine. There's going to be some discussion of different platforms that can be used to connect with patients for various types of visits. We're going to discuss how to maintain a professional website manner, and we're going to review how to do a physical exam through telemedicine with some specific discussions surrounding how to do rhinology visits through telemedicine. We'll also review billing and coding for telemedicine. In terms of predictions for the future regarding telemedicine, I hope that the Centers for Medicare and Medicaid Services are going to make its temporary waivers permanent. If payment for telemedicine visits remains on par with office visits, I think that telemedicine will continue to be used by otolaryngologists and allergists after the pandemic is gone. With the ability to have inexpensive spirometers at home, patients with asthma can actually be followed just as well at home as they are in the office. Telemedicine can help free up some much needed exam rooms that are going to be needed for social distancing, for observation after immunotherapy, injections, after oral immunotherapy, and after biologic administration in the office. Telemedicine also can help make your waiting room less busy and can allow for easier social distancing for those patients that do come in to see you in the office. Our post-COVID-19 practices are going to look very different from our pre-pandemic practices. Most otolaryngologists and allergists are planning on maintaining these guidelines long after the pandemic has peaked. In this segment, we're going to discuss social distancing in the otolaryngology and allergy practice with a focus on how to safely triage respiratory complaints in the practice, plus how to triage patients when we start physically seeing patients back in the office. Being prepared is of the utmost importance now, and we're going to discuss the importance of the what-if team. We are all very concerned about performing procedures in this post-pandemic era, and Dr. Brooke is going to give us some guidance on this. COVID-19 has had a huge impact on all of medicine, and this includes residents as well. Dr. Crosby is going to give us some insight into how this has and will affect the training of otolaryngology residents going forward. Cash flow is a key to keeping our practices afloat, even in the best of time, but it is especially important now. In this segment, we're going to discuss how to balance procedures, new patient visits, and surgeries. We're also going to highlight the importance of working our AR. Dr. Vander Ark is going to review all the different loan programs that are out there and what our obligations would be associated with them if we did accept money from them. The big question is, will all the different government bailout loans be enough to keep practices from closing? Many practices have high overhead, even in the best of times. Now with the volume of patients way down and with the loss of spring allergy 2020 income, the added strain may actually be too much for small and large practices alike. How long is it going to take in the post-corona world to get patient volume back to its previous levels? Clearly, we're going to be in a recession. How long and how severe it will be is not yet known at this point. Many of our patients or parents of our patients may not get their jobs back, and they may lose their health insurance. My prediction is that for otolaryngologists and allergists, either merger or buyout by other practices, hospital entities, or private equity groups may be the answer for survival. Dr. Hertler is going to share her insights on this with us. I see the pandemic as an opportunity to innovate, to think about how our practices can best utilize our resources, face-to-face time with patients, and how and when to best leverage virtual visits in a way that actually improves patient health. The goal, of course, is to meet the needs of patients while keeping everyone safe. As restrictions ease, many physicians are going to face an enormous backlog of patients, and they're going to need to find new ways of triaging the most serious cases. Telemedicine will help, but I predict that many of our colleagues are going to be working longer hours and on weekends to try to catch up. Otolaryngologists and allergists are going to have to really think about ways of optimizing their time, and their workflow is going to need to be very efficient because the backlog of patients is going to actually be prodigious. Dr. Sale, Patel, Wilson, and Dawson are going to walk us through some HR concerns and help us think about ways to make our practices more efficient. I do believe that otolaryngology and allergy practices that do survive will become leaner. This means they're going to employ less staff, they're going to cut back on expenses, and they may close satellites in order to reduce overhead. There may be less of the bread and butter allergic rhinitis patients starting immunotherapy injections. We may have to look at other sources of revenue streams. And this brings us to part 5. Dr. Patel is going to discuss SLIT as the possible post-pandemic answer for immunotherapy. Dr. Khalid is going to walk us through the importance of keeping our brand intact and some novel ways to rebrand our practices. The allergists who do stay in practice, learn to control overhead, and use telemedicine effectively are going to prosper and thrive. The number of allergy patients will continue to grow. However, the number of board-certified medical allergists will not. This pandemic will probably push many older board-certified medical allergists to either decrease their workload or to just completely retire altogether. And their reduction won't be completely made up by newly graduating allergists from fellowship. Therefore, ENT allergists will have increased patient loads, which may make up for some, if not all, the decrease in volume. But I predict that we're going to have to look at other revenue streams. Dr. Stetson is going to discuss some other possible revenue streams for us, and this will then be followed by an interactive panel that is going to discuss these new revenue streams. I believe that there's an opportunity for peanut OIT and biologics to bring more patients into our practices and generate needed revenue. Above all, we still remain clinicians, and this is important in that we continue to provide important care for our patients. There are some special clinical concerns that we're going to be highlighting, including food allergy, asthma, the use of steroids, and biologics. I believe that there are many questions about how to reinitiate subcutaneous immunotherapy injections in our patients who have been off of injections during the quarantine. Dr. Platt is going to provide us some much needed guidance on this extremely important topic. Ongoing uncertainty and a number of stressors related to COVID-19 may increase physician burnout. To combat feeling burned out and to promote our own wellness, we should remember that everyone is being affected by changes related to COVID-19, and we really all should aim to be kind and compassionate to one another. We should recognize that we will likely not be as productive as we were at our baseline, and that is actually okay. Physical and social distance does not have to mean loneliness. Try to make meaningful connections by reaching out to friends and colleagues, just like we are here on this virtual offering.
Only a foolish optimist can deny the dark realities of the moment. And yet our distress comes from no failure of substance. We are stricken by no plague of locusts. Compared with the perils which our forefathers conquered because they believed and were not afraid, we have still much to be thankful for.
I definitely think that the words of FDR continue to ring true even today. I do think that compared to our forefathers, we do have much to be thankful for. I predict that for practices and doctors who make it through this, we're going to probably be better, stronger, and more efficient. This shock, unfortunately, has uncovered a lot of weaknesses in the American healthcare system that we doctors have known about and been complaining about for a long time. It's going to take an open mind and lots of continued flexibility, both on our parts as well as the parts of hospitals, healthcare systems, and the government to try to make these changes. The one constant, however, is change, and this pandemic is going to make change occur faster than before, but we will adapt just as we have done in the past. We will come out stronger, and the AAOA is going to be with you every step of the way to help support you. The AAOA has many resources that can help reduce the burden for you. I believe that the sun will continue to rise, and I look forward to seeing all of you again, hopefully soon, at one of our live CME courses. Until then, stay strong, healthy, and safe as you continue to provide important care to the allergic patient. And please take care of yourselves because your patients, your family, and the specialty of otolaryngology and allergy needs you. Thank you.